So this actually wrap job is a wrap job for the shoulder. It's kind of like what I call the poor man's support if you didn't have a brace, and it's usually for some instability to the glenohumeral joint, usually some anterior instability. So we go ahead and position the athlete in this position called that teacup position. Put their hand on the hip, they're internally rotating, and then we're going to start our wrap job going in, so going towards their body. And all things considered, hey, you might even want to like spray their chest and their arm to make sure that the ACE wrap sticks a little bit better. But sometimes you're just doing this in on the field and over a sweaty a t-shirt or other top, and so you're just trying to get it on there to give that athlete some support. So just real quick, so showing that we've got some options. I always look at, I'm going to use double length ACE wraps, whether it be a 4 or 6 inch, and heck, on this one I'll use the 4-inch one here just to get going. Things to consider too is you don't want it to be on so tight that we cut off their circulation. Remember, their brachial arteries right here on the medial side of their upper arm. So I'll go ahead and start in here this way, and also I want to make sure that I come across the joint, and then I'm going to go underneath the other arm, and then when I come up on the other side, it's almost, I'm making that, if you look here, kind of making that, that crisscross, and then what I want to do is then make sure that I have some other coverage, not directly over that strip that I just did, but kind of above it, and then even below it a little bit. So here, coming up this way as I come across, so I'm kind of overlapping. When I come down on this side, it doesn't really make a difference if I'm, like directly on top of that strip on that side. Now when I come back up on the other side, so the back side, you'll see where I'm going to do the same thing, where I'm going to get that kind of overlap. You can kind of see this kind of pattern. And then at least I kind of look at, I try to get, at least 3. Now here's my third one. So I've got, one underneath, second one on top, and this third. So I've actually covered, if you look at it, like an inferior, middle, and a superior strip. So at least I want to get my 3. And then, like I said, you look at the rest of the ACE wrap, we're kind of at that point where, all right, we're about done. So I could always then continue to carry it one more time across. And I'm not like really stretching the heck out of the ACE wrap, but I am, giving some tug on it. Because if you do too tight, you may cut off the circulation. I'm gonna go ahead and spin my athlete here just to show you where, hey, we just happen to end the darn ACE wrap here. Kind of an awkward spot, but what I'm gonna do, and I'm not recommending obviously use this while you're trying to do it for participation, but I'm doing this just to kind of get it set up to tape. So I'm just gonna do this in order to hold it in place. Sometimes I have the athlete or another student help me out. But so in order to secure this down, you've got some options. If you just have a straight athletic tape, then you might just be running some strips this way, in order to secure this down. But I happen to like to use like this Coflex tape, so that hybrid type of tape, and I'm gonna grab this here, like a 3-inch. And then what I do here is, I'm gonna go ahead and spin my athlete again, is I just follow kind of that same pattern where, I can start around the arm here, or I could go across the chest here first, and then now I'm at least securing. I've got one. Think of like, okay, I'm going to start this and stop that. If you look at that, remember the patterns really are just, it's figure 8s, right? Okay, but right here, like that's where that clip was, right? But we're securing this, so you may go like, on the average maybe 2 or 3 times around. Again, just have to make sure it's not on too tight. Hey, we've all done this, in the past where we've done this type of a wrap, and sure enough, I remember football this past year, I had an athlete come back and he's like, oh, Pi George, I can't, feel my damn hands because it was on really snug. Well, so we got to be aware of that, issue of their circulation. So I would just tear that off and cut that off. That's fine. You want to check a distal pulse, make sure that it's nice and strong. You could even do capillary refill. But the biggest thing is, even when you check these right now, it's a lot different when the athlete then goes in and they've played a couple downs, if it was football, or doing something, and then they come back. So listen to them. They're the ones that are going to be honest and tell you, hey, I can't feel my fingers, or they're tingling, or it's too loose or whatever. So sometimes you got to go ahead and readjust. All right. So and again, if you look at this, it's basically just figure 8. And again, we start in that teacup position, internal rotation, hand on the hips, and start in, and then come around. Okay, and pretty simple. And here, what I'll do real quick, pardon me.